Hello, brain explorers and medical science enthusiasts. Welcome back to Life of Medical. I'm your host, and tonight, we're journeying into the intricate world of the human brain with a fascinating piece of technology that listens to its electrical whispers, the electroencephalography (EEG) device. Our deep dive is titled Unlocking Brainwaves, your comprehensive guide to the electroencephalography (EEG) device and test. This non-invasive procedure helps doctors understand brain activity and diagnose a variety of neurological conditions. So, let's tune into the brain's frequency. What is an electroencephalography (EEG) device and what does it measure? First up, what exactly is an electroencephalography (EEG) device and what incredible information does it gather from our command center, the brain? An EEG machine is a sophisticated medical instrument used to record the electrical activity of the brain. Our brain cells, or neurons, communicate with each other through tiny electrical impulses, firing in complex patterns. This collective electrical activity, known as brainwaves, can be detected from the scalp. The EEG device uses small metal discs called electrodes, which are attached to specific points on your scalp, to pick up these faint electrical signals. The machine then amplifies these signals and displays them as a series of wavy lines on a computer screen or, traditionally, on a strip of paper. This recording, the electroencephalogram, provides a visual representation of brain function, helping to identify normal and abnormal patterns of electrical activity. It's a window into the brain's real-time operations. How does an EEG device work to capture the brain's electrical activity? Now, let's explore how an EEG device manages to capture these subtle electrical conversations happening within the brain. The process relies on those strategically placed electrodes. Typically, between 16 to 25 electrodes, sometimes more for detailed studies, are attached to the scalp using a special conductive paste or gel that helps ensure good electrical contact and reduces interference. These electrodes detect the minute voltage fluctuations resulting from the ionic current flows within the neurons of the brain. The EEG machine then takes these tiny signals, which are in the microvolt range, and amplifies them significantly, often by a factor of 100,000 or more, to make them large enough to be recorded and analyzed. The machine records the electrical activity from multiple points on the scalp simultaneously, allowing clinicians to see how brainwave patterns vary across different regions of the brain. This multi-channel recording is crucial for localizing abnormalities and understanding the brain's complex electrical landscape. Where are EEG devices commonly used, and for which patient populations? You might be wondering, where are these brain monitoring EEG devices commonly found, and who benefits most from them? EEG machines are staple equipment in neurology departments of hospitals and specialized neuroscience centers. They are crucial in epilepsy clinics for diagnosing and managing seizure disorders across all age groups, from newborns to the elderly. Pediatric neurologists frequently use EEGs to assess brain development and investigate neurological issues in children. EEG is also used in intensive care units, ICUs, to monitor brain function in critically ill patients, such as those in a coma or following a severe head injury. Sleep labs extensively use EEG as a core component of polysomnography, sleep studies, to diagnose sleep disorders like sleep apnea or narcolepsy by tracking brainwave changes during different sleep stages. Furthermore, EEG can be employed in research settings to study cognitive processes, brain-computer interfaces, and the effects of medications on brain activity. When is an EEG test typically recommended by doctors? So, when do medical professionals typically recommend an EEG test for a patient? An EEG is often ordered when a patient experiences symptoms that suggest a neurological problem affecting brain function. The most common reason is to investigate, diagnose, and monitor seizure disorders like epilepsy. If someone has had a seizure, an EEG can help determine the type of seizure and where in the brain it might be originating. It's also used to evaluate unexplained loss of consciousness, confusion, or prolonged periods of unresponsiveness. Doctors may recommend an EEG to help diagnose or rule out conditions such as brain tumors, brain damage from head injuries, inflammation of the brain, encephalitis, stroke, or certain psychiatric conditions that might have an organic brain basis. In sleep medicine, it's key for identifying abnormalities in sleep patterns. Essentially, anytime there's a need to assess the brain's electrical function directly, an EEG is a valuable consideration. Why is the EEG such a crucial tool for understanding brain function and diagnosing neurological disorders? This leads to the question of why the EEG remains such a crucial tool, especially with other advanced neuroimaging techniques available. The EEG's unique strength lies in its excellent temporal resolution, meaning it can detect changes in brain activity that happen very quickly, on the order of milliseconds. This is far faster than imaging techniques like MRI or CT scans, which show brain structure but not its real-time electrical function. This makes EEG invaluable for studying dynamic brain processes and for capturing the fleeting electrical events characteristic of seizures. It's also non-invasive, relatively inexpensive, and can be performed at the bedside if necessary, making it accessible and patient-friendly. For conditions like epilepsy, the EEG provides direct evidence of abnormal electrical discharges, which is fundamental for diagnosis and guiding treatment. It also plays a critical role in determining brain death by showing the absence of brain electrical activity. Who performs an EEG test and who interprets the complex brainwave patterns? Understanding who is involved in the EEG process is also important. The EEG test itself is typically performed by a specially trained healthcare professional called an EEG technologist or neurodiagnostic technologist. These technologists are skilled in accurately measuring and marking the patient's head, applying the electrodes correctly, ensuring patient comfort and cooperation, which is vital for a good recording, and operating the EEG equipment. They also know how to perform activation procedures, like asking the patient to breathe deeply or look at flashing lights, to elicit certain brain responses if needed. Once the recording is complete, the interpretation of the complex brainwave patterns is done by a neurologist, often one who specializes in neurophysiology or epilepsy. These physicians have extensive training in analyzing EEG tracings to identify normal rhythms, distinguish artifacts, and recognize abnormal patterns indicative of various neurological conditions, providing a clinical diagnosis. Preparing for your EEG, ensuring the best brainwave recording. If an EEG is in your future, knowing about preparing for your EEG, ensuring the best brainwave recording can be very helpful. Preparation for an EEG is generally quite simple. One of the most important things is to have clean hair, free from oils, sprays, or conditioners, as these can interfere with the electrode contact. You'll usually be advised to wash your hair the night before or the morning of the test and not apply any hair products. Unless specifically instructed otherwise by your doctor, you should take your usual medications. You may be asked to avoid caffeine, from coffee, tea, soda, chocolate, for 8 to 12 hours before the test, as stimulants can affect brainwave patterns. If the EEG is part of a sleep study or intended to capture sleep activity, your doctor might ask you to sleep less the night before the test to help you fall asleep during the procedure. Always follow the specific instructions given by your doctor or the EEG lab. The EEG experience. What happens during a brainwave test? So, what's it like to have an EEG? Let's walk through the EEG experience. What happens during a brainwave test? The procedure is painless and non-invasive. You'll be asked to lie down on a comfortable bed or recline in a chair. The EEG technologist will measure your head and mark the spots where the electrodes will be placed. They will then attach around 16 to 25 small electrodes to your scalp using a special adhesive paste or an elastic cap embedded with electrodes. Once the electrodes are in place, the recording begins. You'll be asked to relax, stay still, and keep your eyes closed for parts of the test. The technologist may ask you to perform certain tasks, known as activation procedures, such as breathing deeply and rapidly, hyperventilation, for a few minutes, or looking at a bright, flashing light, photic stimulation. These tasks can sometimes trigger abnormal brain activity that might not appear when you're at rest. The entire procedure usually lasts about 60 to 90 minutes, including setup time. Decoding brain rhythms. A simple look at alpha, beta, theta, and delta waves. The EEG records different types of brain waves. Let's try decoding brain rhythms. A simple look at alpha, beta, theta, and delta waves. These waves are classified by their frequency. Alpha waves, 8 to 13 Hz, are typically seen when you're awake and relaxed, with your eyes closed, often prominent in the posterior regions of the brain. Beta waves, 13 to 30 Hz, are faster and are usually associated with active thinking, alertness, concentration, and anxiety. They are generally seen when your eyes are open and you're mentally engaged. Theta waves, 4 to 7 Hz, are slower and are common during light sleep, deep relaxation, or meditation. They can also be seen in young children when awake or can indicate certain brain dysfunctions in awake adults if prominent. Delta waves, 0.5 to 4 Hz, are the slowest and highest amplitude brainwaves, characteristic of deep, dreamless sleep in adults. The presence and patterns of these waves, and any deviations from normal, are what neurologists analyze. Beyond seizures, other important uses of EEG. While EEG is famously used for epilepsy, it has many beyond seizures, other important uses of EEG. As mentioned, it's a cornerstone of sleep disorder diagnosis, helping to identify stages of sleep and abnormalities like sleep apnea or narcolepsy. EEG is used to monitor the depth of anesthesia during surgery, ensuring the patient remains appropriately unconscious. It can help in the evaluation of patients with altered mental status, confusion, or coma to determine the cause and assess prognosis. In some cases, it can support the diagnosis of certain types of dementia or encephalopathy, a general term for brain disease, damage, or malfunction. It also plays a crucial role in the determination of brain death, where a flat EEG, showing no electrical activity, is one of the confirmatory criteria. Research applications are also expanding, including studies of cognition, learning, mental health conditions, and the development of brain-computer interfaces. And that concludes our fascinating journey into the world of electroencephalography. It's truly a remarkable tool that provides invaluable insights into the electrical symphony of our brains. I hope this episode has demystified the EEG test for you. If you found this information useful, please give us a thumbs up, subscribe to Life of Medical for more deep dives into medical technology, and don't forget to hit that notification bell. Stay curious, keep learning, and we'll see you in the next video.